if everybody's willing to kind of jump in and participate, I think that would be great. But I'm going to let Jamie kind of introduce this evening and what we're here to do, and then we'll get started.
Hi, great. Thank you, Jenna. So I own a restaurant. It's Meritage Restaurant. It's in Scarsdale. I'm also an intuitive energy healer and a cranial sacral therapist, and I teach meditation. And I've just been envisioning a way to integrate my the two parts of me into the restaurant. And this has been going on for a couple of years, this like imagining of how to do that and how to bring wellness into the restaurant. I mean, I practice it as like personally within my business, but it's not something that I share a lot with everybody. So I reached out to the Mental Health Association of Westchester. I guess it's been a couple years ago now. It was before COVID. And they were so just open to the conversation. And we, discussed a whole bunch of different things. And then COVID happened. And probably about 4 months ago, I started to envision this again. And it also seemed very appropriate because of everything that's going on. And I connected with the Mental Health Association, and they were just so open to this. And I just want to say thank you to you guys. You guys have been so amazing to collaborate with, and just been really generous with your time and all your resources. I'm really appreciative of that. So thank you. And yeah, so we just kind of came up with this collaboration, and this is, what we're doing now. So the restaurant is going to collaborate with various different mental health organizations, practitioners, healers, to have a series of different workshops. And some of those we'll be doing with the Mental Health Association of Westchester. So it's just a really exciting collaboration and opportunity to bring mental health awareness to the community. So that's it.
Thanks, Jamie.
Yeah.
And truly, I mean, we thank you also. For us, it's a delight to be able to have somebody reach out to us from another industry and say, hey, I'm really interested in mental health awareness and helping those who I come into contact with through my business learn about mental health and taking care of our mental health. So yeah, we're delighted to do this and excited to see where it goes, because I'm really hoping that next time we do this, we could be in your restaurant and doing that, or at least together, because as things are starting to kind of open up a little bit more, I think it'll be fun just to do that in person and be able to be in the same room. So yeah. Absolutely. All right. So May is Mental Health Month. So we thought this would be the perfect month to kind of kick this partnership off and say, let's talk about this. So the theme that Mental Health America has come up with for this year is all about thrive. And so for us, this is how can we help our community thrive? And we're going to actually talk a little bit more about each of these letters, because we have each of them kind of standing for something, one of the tools that we can use in our lives to thrive. So we will talk about that a little bit later, but I did first, since we're doing this in the vein of mental health awareness, be able to provide a little bit of information just about mental health in general. And so I think it's important to recognize that according to statistics, nearly 1 in 5 American adults will have a diagnosable mental health condition in any given year. So 20% of our population at any given time will meet the criteria for a diagnosable mental health condition. And almost half of Americans will meet that criteria at some time in their life. So not at every time. It's not as if half of our population meets the criteria at all times, but that at some point in their life. And for half of those, that occurs by the age of 14. So mental health is pretty prevalent, mental health conditions. But then we contrast this with the fact that in Mental Health America's State of Mental Health in America report, which is all based on survey data. So they collect data from people who come to their website to maybe take surveys and learn about how their mental health is doing, that for those who met the criteria potentially for having a mental health condition, 56% of them were reporting that they had not received any mental health treatment in the last year. So we're saying, look, we have all like really high percentages of people who are susceptible to developing a mental health condition, but there's many of them that are not seeking out that treatment. And we know that there's a lot of reasons for that. Sometimes it's about having access. Sometimes it's about having insurance that will pay for it, or even just being able to pay for a copay or a high deductible or things like that. But we also know that a lot of that is related to stigma and the idea that, well, I mean, I don't want to go seek mental health treatment because maybe that says something about me that is not good, or this is not something that I want to have associated with me. Why are we not moving forward here? There we go. All right, and so I just thought, look, anecdotally, we hear this all the time, right? The news is reporting this constantly. The media is telling us about how COVID is impacting on mental health, but I thought this was a really helpful graph just to kind of show the differences, with the yellow being before COVID and then blue being during COVID, what people are reporting. This is from the CDC library, that these are adults reporting that they're living with depression symptoms. And so almost 75% prior to COVID were saying, no symptoms at all of depression. And that dropped all the way down to just under 50% during COVID. But in every other category where the symptoms of depression are either mild, moderate, moderately severe, or severe, that flip-flopped. So it was less, the percentage of adults reporting that was less before COVID and higher during COVID. So just, that clear data showing the connection between depression rates and what we've all been experiencing in the last year. And so I think it's understandable, right? We were living through a pandemic. We were living through a period of political unrest, and racial injustice was highlighted and really spotlighted for us in a way that maybe should have been before, but hadn't been before. And so it's understandable that we're reacting to that in this way. But I also think, it's also helping people understand depression in a different way. Whereas before, maybe people would think like, oh, come on, just shake it off, or just focus on the positive, or this, like all those other things that people say, like maybe to understand, wow, this is real. Depression is real. And these are not symptoms that you can just will yourself to not have. And so in some ways that could be like the positive silver lining, that maybe people are starting to understand that mental illness is real. It's actually a real thing. It's not something that people are just making up or, deciding they want to feel this way. So if you want to find a little positive in that, I think it's helping us combat the stigma a little bit. And there are a lot of risk factors for developing mental health conditions. So there's genetic risk factors that's clearly been shown over time. There are also biological risk factors. So meaning that, people who have a traumatic brain injury are more susceptible to mental health condition later on. So things like within the biology of the brain that can actually lead to a mental health condition. There are also environmental and lifestyle factors. So environmental meaning there's a lot of research that shows even the experience of having adversity and adverse childhood experiences in your childhood can actually change the structure of your brain and actually lead to a lot of negative health outcomes later on in life, that there's this connection there. It doesn't mean that it has to happen. There are things, resilience factors that can actually buffer against the effects of that. But the point is, like, that environmental situation can influence somebody's mental health later on. And then lifestyle factors, what we eat, the habits that we engage in, and what we put into our bodies, even the jobs that we have. There are certain jobs that have higher levels of depression and stress associated with them. So those are kind of the lifestyle factors that may be risk factors. So I think it's always important to think about what are some of the early warning signs that if somebody's developing symptoms of a mental health condition, what might they notice in themselves? So changes in sleeping, right? Either I'm sleeping all the time or I can't sleep at all. Having a hard time focusing or concentrating on things. It might be hard to, you read the same sentence over and over again, or you can't finish a project at work, or just not able to focus on what you're doing, and your mind is kind of racing, or just having that difficulty focusing. Any significant changes in appetite, eating more or less than you normally would. And again, I say these are early warning signs, meaning if these become persistent, we all have days or maybe even a week or so where we may experience any one of these things. And if you think about what's going on in your life, you might say, okay, I understand why this is happening. I have this really bad thing happening. Maybe I lost somebody, or I'm really stressed out about work or something. And you might notice these things. It's more about if it becomes persistent. And so you want to notice it. If something like this is happening and you or somebody in your life, notice it and know, okay, this is something to watch out for. But when it becomes persistent and is when it's something that, okay, now it's time to address this. And there are certain things, though, that if you or someone you know is experiencing, is a time where you say, you know what, I need to actually reach out for help now. This isn't something to wait on. So anytime that somebody expresses or experiences thoughts of suicide, or starts talking about suicide in a way that they're really, planning that out or thinking about it, that's a time to reach out. That's not something to sit and wait and see what happens. That's always an immediate reach out. Hopelessness, unusual thoughts, seeing or hearing things that others don't. If you've noticed that your mood has been really persistently changed for several weeks, or any kind of excessive substance use, those are times where it's best not to wait and really have that early intervention to say, I need to reach out for help now before the outcome potentially is not good. And I just always like to include some resources whenever we talk about those topics, because you never know, who might be listening and think, oh, well, I've been having thoughts like that, or I know someone who is, and I need to know who to call. So the Suicide Prevention Lifeline, that is the go-to. It's 24/7. It's staffed by professionals. You don't even have to be experiencing thoughts of suicide to call there. If you're just really struggling, they can talk to you and connect you to somebody who can help. And then, of course, at MHA, we have lots of clinics all over the county in Westchester and Rockland, and we're available as well to, so if you wanted to call and set up an appointment, that's where you could go. You could also go to the website to learn about all the other kind of programs that we have at the agency. There are lots of programs that we have. Okay, so now I talked about Thrive a little bit, and I just wanted to take some time to kind of go through that acronym and share some of those tools to thrive that we have been focusing on this month. And say focusing on this month for Mental Health Month, but really these are applicable all the time. And we're going to dig a little bit deeper into some of them, and then have an opportunity to actually engage in a mindfulness meditation at the end of this. But so the T in Thrive. So for us, we're defining that as take care of yourself. We know how important self-care is, and self-care isn't about, well, it could be about a lot of things. I shouldn't say isn't about, but it's not just getting a manicure or getting a massage, or some of the things I think that people think about, like very indulgent kind of things, but it's really about, what do you do every single day to take care of yourself? Do you have a daily routine that's all about focusing on you and your wellness, whether that is waking up 15 minutes before the rest of your family wakes up so that you can have some quiet time and just sit and do nothing and just be in the quiet, whether that's getting up early to exercise and do like a really strenuous workout, or just go for a walk, take your dog for a walk, or read the newspaper, have a coffee. Or is it a routine that you have on your way home from work, listening to really calming, relaxing music? The point is that taking care of ourselves needs to be a priority. And if we're going to thrive in life, and if we're going to have thriving mental health, then we need to be taking care of ourselves, because we can't rely on anybody else to do that for us. And it's important. We cannot do the rest of the things that we want to do in our lives. We can't take care of other people. We can't be there for ourselves and the other people in our lives without doing that. And so I wanted to share the 8 dimensions of wellness. So the 8 dimensions, these are all mutually interdependent dimensions, but they do have the capacity to impact each other. So it's not as if you have to have complete balance in all of these at all times, but they're all of equal importance. And if one is really being neglected, it can actually impact the other dimensions as well. And so I think what's really important is that when we take all of these different dimensions, we need to figure out, like, how can we strive for our own personal harmony? Because we know in ourselves that maybe one of these is more important than another for us as a human being, and we know what works best for us. So we may have to really nurture that, or we may know this is an aspect that I have really neglected for a long time, and so I need to really intentionally focus on this one, knowing that it's going to strengthen all these other areas as well. And so what I find to be really helpful is just thinking through, okay, so what are the ways I take care of my intellectual health? Like, how do I make sure that I'm being intellectually stimulated? Is it doing a crossword puzzle? Is it making sure that the job that I go to every day challenges me and forces me to really think and do things that are, that are fulfilling to me in that way? Spiritually, what does that look like? What does that look like for you as an individual? Is that about prayer? Is that about meditation? Is that about connecting to nature? And then, emotionally. So, and I don't think we have time to go through all of these in depth tonight, but I think it's important to, and I can share this with anybody who wants it. You can actually look these up. If you just look up the 8 dimensions of wellness, you're going to find lots of resources about it. And if you, I've seen before too, some people, like, they create a little worksheet, right, to say, all right, so what are the ways that I nurture my my health in each of these different domains, and where am I really strong and where am I struggling? And what kind of intentional actions do I need to take to either maintain the strength in the areas that are most important to me, or sort of bolster the ones that I'm not feeling as strong in? And then decide from there. So it's not, you don't have to like go huge. It's not, okay, so I've been neglecting my physical health, I'm going to train for a marathon. Maybe, right? But it could just be, I'm going to make sure that I go for a walk every day, or that I, maybe I work out really, really hard. And for me, that physical nurturing is, I need to make sure I'm also stretching or taking days off, or, going lighter sometimes. So, and then you want to think through, okay, so which of these do I really need to engage in on a daily basis to stay well and healthy? So, because we know ourselves best, right? Like, there's some of these that you're going to have to do on a daily basis to feel okay. And then there may be others that you say, okay, this one, maybe I can intentionally focus on once a week. And then there may be others that you have to intentionally focus on less frequently than that. But I think the main point is, it's all about intention. Like, how are you intentionally taking actions to strengthen these different dimensions in your own life? So, curious, and actually, feel like I'm talking a lot, and I'd love to hear from any of you, if you'd like to share just maybe what you've learned about yourself in terms of, which of these are most important to you, and how you've nurtured these different aspects of wellness. So you can feel free to unmute yourself if you want to, and no pressure, but if you'd like to participate.
It takes me a second to figure out how to unmute myself. Don't spend a
I
lot
hear
of
you.
time on
Yeah.
Zoom. I guess the biggest one over the pandemic is just both, I guess, social is the biggest one because I haven't seen my friends, so many of them, in so long.
Mhm.
Physically been with them. I've seen Jamie at Meritage a few times, but for the most part, me and my friends haven't spent a lot of time hanging out together in the last 15, 18 months, whatever it is.
Mhm.
So it's been a long year.
Yeah.
And physical is the other one because it's hard to go to a gym these days. It's been hard for quite a while. So we've
Yeah.
got our pandemic bodies these days that we have to learn to love and appreciate. So now trying to figure out, all right, how do we rebuild post-pandemic? That's the tricky part.
Right. Yeah, thank you for sharing that. I'm sure I would imagine that there's probably other people who would have the same things. And so my challenge, or what I would ask is, so have you been intentional? Have we, I should say we, like the royal we, right? Have we been intentional? How can we be more intentional about each of those things? And really thinking through, like I said before, what do I need to do today? What do I need to do daily? What do I need to do weekly? And really kind of building that into, because I think without intention, it's so easy to just let what's going on around us dictate how we respond. So anybody else?
My need for exercise. I just jumped on the exercise bike. When you brought this up, it's like, you know what? I can watch and jump on my bike here
I love that. I love it.
because I don't do it enough. But it's
That's
a way
great.
to get a little bit of, exercise there. I tend to
love
do
that.
more of the intellectual with puzzles and things, and some outdoor nature.
Yeah. Great, thank you. Anybody else want to share? Okay.
I'll share actually.
Oh, great.
It's interesting. The physical one feels, for me, it's the same for me as well. That's interesting. But my experience has been, this is my struggle I'm having, is that at work, it's a very specific physical. And so and then I'm exhausted because of that work, but I feel like I need a different kind of physical, like something that raises my heart rate, or like just a different thing. I don't know. So I don't know, just
Yeah.
interesting. It's all the same.
I know it is, right? Because it's not as if you're inactive, but your physicality or what you're doing physically isn't what you need in order to achieve that wellness. It
Right.
sounds like is what you're saying.
Yeah, exactly. Thank you. Yeah,
Mhm.
that you'd articulated that very well.
That's right. Okay. Yeah. And sometimes we don't even think about it, right? Like I realized at a certain point during the pandemic, like, oh, I kept finding myself really wanting to do a crossword puzzle after I put my kids to bed. Like I have the newspaper and I was like, okay. And I realized like maybe I just needed, first of all, like not to be looking at a screen, but also something that was engaging my brain in a different way. It wasn't just mindless, like I felt, and I wasn't intentionally doing it. But now that I know that that's kind of important to me and how I feel at the end of the day, I'm like, okay, maybe I should, build this in. So sometimes what we do unintentionally, we learn from that too. And then it becomes more of an intentional practice. All right.
I just want to, Shannon wrote a little note in the chat. She said she can't unmute because her kids are yelling. So she says, I found that I have a much better day mindset if I set time aside in the beginning of the day to start my day in silence, to practice some yoga or Pilates and do some spiritual reading.
Yeah, that's good. And I love that she shared that she needs that quiet time as she simultaneously shared that her kids are screaming and she can't unmute. So, I mean, very poetic, Shannon. And I get it. All right. So, and as we move on in our Thrive acronym, so we have H for helping others, because actually what we've realized, and And, you know, and this is borne out in research too. I mean, when you are helping others, it actually really feeds you spiritually as well. And I think, you know, if you've ever been in that position of, I always think back to, I don't know if anybody watches Friends, but there was this whole episode where Phoebe, one of the characters, you know, she was really trying to do something that was not selfish. And she's like, but I feel good when I help other people. So that, even that is selfish. It's like, yeah, you think about it, but it's so true, because when we help others, it doesn't take away from the fact that, you know, it is helpful to somebody else. But it feeds you as well. And it brings about that feeling of just sort of like purpose and, you know, like, okay, so I feel like I have a purpose here, and there's meaning in the things that I'm doing. And it can be really, really simple. It doesn't have to be something huge. And oftentimes, if it's somebody who's in distress, the most helpful thing that we can do is just listen. And, you know, if you've ever been in a situation where you're really dealing with something that is challenging, and there's not an obvious solution, it's just having strong emotions about something, and, you know, just to feel the power of what it's like to just have someone listen to you and be there and be present with you. So it really doesn't have to be anything big, and it could even just be saying something kind to somebody else or expressing gratitude for something. All of that just brings these positive feelings of connection. Okay, so the R in Thrive is for build resilience. So resilience is something that we talk about a lot. And really what it is, it's being able to adapt to challenging life situations and get through it. And it doesn't mean you don't experience negative or strong emotion during it, you know, if there's an adversity, but that you come out the other side and things are basically the way they were before, right? There's not any lasting negative impact on your life, physically, emotionally, spiritually. And for some people, that may even look like growth. That could look like, actually, my life has changed for the better after this thing. So again, not taking away from the despair or, you know, trauma that you might experience during that adversity, but that at the end of it, you could come out feeling stronger or with a new purpose in your life. And so growth or resilience, getting through that. And so it's interesting, because I think when we hear about people who experience real tragedies or adversities, you often hear the statement like, I don't know how you got through that, or I would never have been able to get through that, right? Like we have this expectation that if you experience something bad, that you're not going to be okay after. But actually the research shows that the majority of people who go through something traumatic or, you know, have adversity in their life will experience resilience. And I think that's important for us to emphasize all the time, because if we set ourselves up to expect and believe that, then it doesn't mean we won't feel strong feelings during what we're going through, but we have that hope that, okay, the most likely outcome here is that I will be okay and I'll get through this. And I think it's just important to set ourselves up that way. And that there are actually things that we can do to build resilience. And so these are just some of the ways that we can build. We know that connection and having a supportive individual in your life who really is in your corner is actually the strongest buffer against adversity and the largest factor in resilience. And so staying connected with a support system or developing a support system is really important. And even if you say, well, I don't have anybody in my life, I'm not close with my family, I don't have a lot of friends, I don't have somebody that I can count on. Again, it's about, all right, so then really being intentional about finding that. It doesn't need to be a huge group. It doesn't have to be a huge system. It could be one person. And maybe you find that person through a support group, you know, focused on whatever it is that you're going through. So you find a kindred, somebody who understands the experience that you're having. Or maybe it's really just nurturing a friendship you have in your life that you haven't really nurtured, and seeing how that can be a support. But also it's important to acknowledge and accept your own feelings. So trying to push ourselves to that resilience, or, you know, trying to push ourselves to grow through our adversity too soon without allowing ourselves to actually experience the feelings that we're having and accept those, is not the way to do this, right? You have to let yourself feel what you're feeling, and know that that's okay, and allow yourself to fully process that, and then get to that point where, okay, I can start to, you know, move out of this. It doesn't mean you won't still feel sad about what happened, or that things won't still make you feel bad, but that you allow yourself to feel that as it comes. And we also know that talking about your struggles and your victories is really important. So sharing with other people, talking about what you've been through and how hard it has been, and also sharing what you've been through and how you've sort of come through that. It solidifies it in your own mind. Hearing yourself say it out loud allows you to create that narrative in a way that supports your growth and resilience. And maybe at times that means seeking help from professionals. You know, it may mean that you need someone to help guide and walk you through this. And that is perfectly okay, and really, really helpful for a lot of people, because we, you know, one of the other things I want to emphasize is that even though we talked about earlier how mental illness and, you know, all that is real, so is recovery, and recovery is possible. And recovery is what we expect these days when somebody has a mental health condition. It's not something that like, oh, maybe we'll see how it goes. No, this is what we expect. It doesn't look the same for every person, but it is an expectation. And then also, I think it's so important that we embrace this paradox that distress and growth can coexist, right? We shouldn't be trying to, okay, well, I either need to sit in my distress, or I need to be only focused on the positive. Allow those two to coexist together, and that's where the growth really happens. All right, so we're moving on. I interact with others. Okay, so a little bit like what we're doing right now. We know that, you know, having connections with other people and interacting in small and big ways, and deep and shallow ways, I mean, all of them are important. And ultimately, it's those deep connections that have the most meaning. But even just smiling at somebody that you don't know, or holding a door open for somebody, or sharing with someone you like their shoes or their shirt, like those, all those little interactions build up during the day and can contribute to your well-being. We could also have said intention there too. So V for values, recognizing and prioritizing values. So we talked about those 8 dimensions of wellness, right? A lot of times what we find is that the ones that are most important to us reflect our values. So really intentionally engaging in those things, recognizing the things that are so important to us, and really prioritizing them in our lives is essential to our wellness. And then embracing our emotions. And we just talked about that, right? Like accepting what we feel. We are human beings, and we have a world that is, and an environment that is happening around us that is not in our control. And if ever we have known that, it was in the last year, right? So we can't always control the things that are happening around us, and we're going to have emotions that come from that. We're going to have feelings associated with that, and it's okay. And when we accept that and allow ourselves to feel it, then, you know, oftentimes what happens is we're able to get through it in a different way than when we try to suppress it or push it down or pretend that it's not there. And that prolongs it. It makes it, you know, it makes it so that we can't actually process what's happening. Okay, so I am going to turn things over to Jamie, because we're going to have a mindfulness meditation in the vein of, you know, thinking about how we're really taking care of ourselves. So I'm going to allow her to introduce that, but I did just want to put some information up here about MHA and how you can connect with us in a variety of ways. We have, like I mentioned before, clinic services for anybody who is looking for some mental health treatment, or even just to talk to somebody about what they're experiencing. And then the community connection line is really for people who are just looking for a connection, maybe not necessarily to address some, depression or anxiety, but maybe just want somebody to talk to and feel like, okay, so I know that I'm sort of neglecting that social or connection part of my life, and I want to intentionally do that. Here's a way I can do it if I don't have someone to go to in my own life. So, Jamie, do you want me should we kind of bring it back so that we're all together? Would you like people to turn their cameras on, leave them off? How would you like to?
They can do whatever they'd like to do. I don't need to
Okay.
see them.
Okay.
Unless they want me to, but I don't need to see them.
Okay. And then after we finish that, we're going to have an opportunity to just kind of talk a little bit about everything that we've addressed tonight and talk about what this meditation, how you experienced it and how it impacted you. So, so definitely stick around because we want to hear from you also. All right. It's all you.
Great. Thank you. That was lovely. I really appreciated a lot of that. Yeah, we're just going to go into a short meditation, and I just wanted to share how this goes perfectly with what you were talking about, right? This is the wonderful opportunity for you to practice, spirituality and just, taking care of, adding something to your daily routine. This is a beautiful way to do that. And so, yeah, thank you. One thing that I always, before we get to meditation, one thing I wanted to just share is something that comes up very often when I'm teaching meditation is people always say to me, well, how do I stop my mind? How do I stop it? This is like the number one question, fear of starting a meditation practice. How do I stop my mind? Like, it's so crazy. Like, I'm sitting in meditation, it won't stop. And the answer is that's not what you're doing. You're not trying to stop your mind. That's not possible. You cannot control the thoughts in your mind. You will always have thoughts. So put your mind at rest with that, because it's very important to remember when you're in meditation. Let's just go right into it, because I don't have a lot of time to talk. We know the benefits of meditation. There's so much science out there. We all know meditation, mindfulness, helps with many, many different things. So we'll just go right into it just so you can have the experience. So make sure that, I don't know if this is possible for everyone right now, but try to find a quiet place. I don't know where you're sitting. If you're sitting in a chair, that's great. You don't need to sit cross-legged like like the yogi under the Bodhi tree or whatever. You just have to, it's more important that you're comfortable. So whatever your body type is, that's where you need to be, right? So sitting in a chair might be for you. If you're on your bed right now, you can come sit at the edge of the bed. But make sure your feet are connecting with the ground and your legs are at like a right angle. And just close your eyes. If you're uncomfortable closing your eyes, you can also just have a soft gaze. So you have like a little bit of a crack in your eyelid. Some people, it's difficult to keep their eyes closed. That makes them feel uncomfortable. So let's start with intention, because there was a little bit of conversation about that. It's so important in meditation. I love how Jenna mentioned that a couple times, because it's so important as like a way to just change our minds, change the neural pathways, and just shift the way that we're so familiar with thinking. So maybe bring to mind one of the 8 dimensions of wellness that you're working on, or you'd like to work on, developing deeper spirituality. Maybe it's something else. Maybe there's some other quality you're trying to cultivate: peace, calm, less anxiety, all the things. We all have very similar things that we're trying to shift in our lives for deeper happiness. So just bring that to mind. And then we'll do a series of just deep inhales and exhales. And when you exhale, you can make it audible if you'd like. No one can hear you, so it's great to do if you can. So just take a deep inhale through the nose and exhale. And when I'm doing this, sometimes I like to think about bringing in like some quality, some like really positive quality. Maybe it's the intention, right? Inhaling peace, exhaling anxiety, inhaling calm, exhaling anger, something like that. So find something that resonates with you. Could be anything that comes to mind, and just breathe. Couple more breaths. Inhaling, exhale, inhale, and exhale. Then bring your mind to the space where your foot connects with the ground, or if you're wearing shoes, where the sole of your foot connects with the inside of your shoe. Maybe even grow little roots out of the sole of your foot, connecting you to the ground. And then bring awareness to the space where your thigh is connecting with the seat. Place your hands on your thighs if they're not already there. Bring your awareness to the place where your palm connects with your thigh. Then bring your awareness to the crown of your head and reach the crown of your head towards the sky. And as you do this, feel your shoulder blades soften, or your shoulders soften, and your shoulder blades draw closer together behind your back. And as you're doing that, also notice, are you clenching your jaw? Maybe unhinge the jaw, soften the tongue. And then notice, is there a sound? Do you find sound in the room? And then just bring your awareness there. And so what we're going to do is spend a little bit of time bringing your awareness back to that sound over and over again. And what's going to happen is that there's going to be distractions. There's going to be your child knocking at your door. There's going to be, some thought coming into your mind. There's going to be something, your to-do list. All that's going to come in. It's going to come in. It's going to do everything it can to distract you. And what you're going to do is you're just going to say, hey, I see you there, thought. And you're going to go back to the sound. So I'll remind you a couple times. So we'll do this for about a minute. So just find that sound. Come back to the sound. Come back to the sound. And then you're gonna now bring your awareness to your heart center. And your heart center is just to the right of your heart in the center of your chest. And I want you to, on every inhale, feel the expansion of the chest. And every exhale, follow the contraction. So inhale, follow the expansion, and exhale, follow the contraction. So now you can just do this at your own time. Again, following the same guidance with the awareness of the thoughts, right? If you get distracted, if you find yourself often like in outer space, just notice that that's happening, be kind and gentle and loving, and come back to the breath. Come back to the breath. Now I want you to bring to mind someone that you're grateful for. Someone who helps you, supports you. And picture that they're sitting right in front of you. Maybe their knees are almost touching yours. And picture coming out of your heart a white light that's shining into their heart. And I want you to just tell them thank you. And maybe you list a couple things that you're thankful for. And do this until you feel that they actually feel the gratitude. Don't overthink it. Just you'll know when it's complete. And when it's complete, you can just start to wiggle your fingertips and your toes. And when you're all ready, you can just start to open your eyes and just come back into the space. Thank you.
Thank you so much for that, Jamie.
How's everyone doing?
Good.
Good.
Those tough distractions you put in, they did their job very well.
I know, I was wondering if you did that on purpose.
I was like, seriously? Now is
It
when
was
you're coming
so
into the room?
perfect. You really weaved it in well because
Seriously?
that's so life. That is life. Yeah. I'm interested to hear people's reactions of how that felt.
That was refreshing. I was sorry to see it come to an end.
It was interesting to me how so many times exactly what you said was what was happening. So I think it was when you said, do you notice that your jaw is clenching? And I thought, oh man, wow, my jaw is clenching. And there was something else too that, and it, just felt like, oh yeah, I don't stop to think about this stuff enough of how I'm breathing and what's happening in my body. So it
Yeah,
always feels so good.
I could see you when I said the jaw thing. You were like,
Oh, you saw
like I could see you do it. And I was like, gotcha.
Yeah, you got me.
But you know what? That's a really good example of how, or it's because we're all experiencing so much of the same stuff. I didn't say it because I saw you clenching your jaw. It's just because everyone clenches their jaw, so it's just perfect. That's just perfect.
Yeah.
But thank you everyone for, being my little guinea pigs for that.
Yeah, it felt great. Every time
Good.
I do something like that, I think, gosh, I really needed that. Why don't I do this more often?
It's just hard to start the new routine. It's like everything, right? It's hard to get there.
Yeah, it needs to be the intention, right? That's what I was thinking about. Like, okay, so maybe this is an area where, where myself or maybe even someone else here maybe is thinking, this is the intentional piece that I need to focus on.
Yeah.
So.
And it's great because it's one that it's so tangible, the effects of it. Like you all could see how, we could have done that for 2 minutes and just breathing and connecting with your body, like get you out of your head and it feels good. So, yeah, it's great. And there's so many different ways that you can engage in those kinds of practices. I mean, there's just so many things online and there's so many teachers and there's so many, it's so accessible, which is wonderful.
Yeah. Well, thank you for sharing that with us and setting up this whole evening. I'm curious if there's anybody who has any questions that they'd like to ask or anything else they want to share or for either Jamie or myself.
And you may be about to say this, but I'll just that we will be offering through the restaurant mindfulness, meditation, and different groups. So if anyone is interested in that, that will be available. So just wanted to put that out there. So just stay tuned. And then I don't know if you want to share the,
yeah, exactly. So, well, first of all, should people do that by following you on social media or how do they stay connected to what you're doing at the restaurant?
If you follow the restaurant Instagram, that's the best way to do it. So it's Eat at Meritage is our Instagram. So that's
okay.
where we'll be posting all that stuff. And then eventually it'll be on our website.
Perfect. Okay. Yeah. And definitely follow us at MHA Westchester also. And we are planning to come together again next month. The date is still to be determined actually next month is Men's Mental Health Month. And we did a men's mental health panel back in March, and we're planning to do a part 2 follow-up in June. So stay tuned if you're interested in hearing more about that and how you can participate in that. We would love to have as many people there as possible. And yeah, so we look forward to continuing to collaborate with you, Jamie, at Meritage.
Great. Yes. Thank you so much again for all of your help. And thank you everyone for joining us.
Yeah, thank you. Have a good evening.
Have a good night.